Ma? Ma? Are you okay? The nurse said they are ready for surgery. And the operation will be fine.
Hi, Madam Cecilia. Are you okay? How are you?
My mother just worried about the surgery.
I see. This knee replacement operation is beneficial. It helps to relieve the painful symptoms and improve your quality of life. We will inform you about attending joint replacement class. It is best to attend the class with one of your family member. The class involved one-to-one session with our team. We will explain what to prepare and expect after the operation, introduce the rehab exercises for you to know and how to prepare before the operation. Lastly, how to get your house ready to be conducive for your day-to-day activities. Before operation date, you will need to make a visit to Orthopedic Diagnostic Center for joint assessment. The Orthopedic Diagnostic Center assess our patients at pre and post-operation to assist our doctors in monitoring the functional recovery of our patients. Comprehensive assessments are carried out using validated questionnaires and specialized equipment. A nurse will call you before your scheduled operation date. The nurse will inform you the time to report to the hospital and time of operation. Operation will take approximately 1 to 3 hours. Pre-operative preparation. Bring along your admission kit. Consume the medication before operation. Bring any medical notes from the doctor. Bring appropriate footwear with heel straps. Stop smoking as it will cause breathing problems and hinder wound healing. Avoid traditional and herbal medications such as jingo. Take the carbohydrate drink as instructed. Do fast before operation. Do highlight any recent infection involving throat, lung, urinary tract or skin. In this case, the operation might have to be postponed.